I want to give you a very unique perspective on the scapula and how it moves since we have removed the superficial tissues. So if you'll notice, there's the muscle like the deltoid, teres major, latissimus dorsi running on top of the scapula. We also have rhomboideus major, rhomboideus minor, and then the levator scapulae. Now what I'm going to do is I'm going to grab the arm and I'm going to move it. And as I do so, you can see the muscles around it getting tugged on and moved too. Now this is obviously a passive movement. What I want you to do is try and picture these muscles contracting then in a living individual, right? If the rhomboideus major and minor were to contract, you can see that they're attached on this midline, right? The medial margin of the scapula. So what that would do is it would actually bring it over towards the midline. We call this retraction or adduction of the scapula. Now, this muscle here, levator scapulae, it's on top of the scapula. If that were to contract, it would lift the scapula, as in like a shoulder shrug. Pretty awesome. Then, this muscle here called latissimus dorsi is actually running on top of the scapula. I can trace the shape of the scapula here. And so what it's doing is acting to bind that scapula down and anchor it to the rib cage, preventing it from doing this type of movement. I'm lifting the scapula away. When you're trying to learn your muscles, the best thing you can do is picture them and then ask yourself, what happens if point A and point B actually come closer together? What kind of action is that going to have at the joint?